Today I'll be talking about a very important topic, Polycystic Ovarian Syndrome, or more commonly PCOD, PCO or PCOS. This is a very common endocrinopathy in the reproductive age group. Almost 1 in 5 women are being diagnosed with this. It's actually a misnomer because it is not polycystic. There are no cysts in the ovary. This actually causes a lot of concern for the patient because when you tell them there's a cyst in the ovary, they're very concerned. Rather, there are just fluid-filled sacs. These are just eggs or follicles in the ovary. It can be called as a polyfollicular ovary. Most commonly, they come with complaints of irregular cycles, sometimes scanty menstruation, or sometimes heavy bleeding. Another thing is that sudden weight gain, unable to lose the weight. There's increased facial hair, especially on the upper lip, chin, and the chest. There's loss of scalp hair. There is oily skin, acne on the face, and most importantly, infertility, inability to conceive. So what are the long-term consequences of this? Long-term consequences is that there is more incidence of type 2 diabetes, increase in cholesterol, and cardiovascular abnormalities. Also, there is increased incidence of cancer of the endometrium because of increased estrogen in this condition. So diagnosis of this condition is very, very important. The 2003 Rotterdam criteria has told there should be at least 2 of the following 3 criteria. The first is oligo or anovulation. This will cause irregular cycles. The second criteria is polycystic ovaries on the scan. The third is biochemical or clinical evidence of hyperandrogenism. That is, you get hirsutism, acne, oily skin, etc. This same adult criteria cannot be applied in teenagers, that is in adolescence, where multicystic ovaries and irregular cycles are part of the normal physiology. So once you diagnose this, how do you go about treatment? Treatment has to be very holistic. Lifestyle modification is one of the prime things which we advise the patient. The first lifestyle thing is to stop a sedentary lifestyle. Advise them exercise, advise them to stop stress levels, advise them a nutritious good diet. Even 5% weight reduction will go a long way in helping a patient conceive. The next thing that is advised to the patient is depending on her symptoms and requirements. If they are in their teenage years, adolescent years, and they want to regularize their cycle, advise them a course of oral contraceptive pills. And if they have hirsutism, there are medications for it, cosmetic surgeries are there for it. The next most important thing is in the reproductive age group when they come in with complaints of inability to conceive. Most of the PCOD patients will conceive when you give them a short course of medications starting on the 2nd or 3rd day of the cycle. The remaining people can conceive with either oral medication with injections. Very few, up to maybe you can say 10%, require laparoscopic ovarian drilling or puncturing to reduce the androgen levels and thereby help them in conception. But most importantly, we tell is weight reduction mainly. So whenever a patient is diagnosed with PCOD and she is told she is finding it difficult to conceive, she has to remember only one fact, that she is not alone in this struggle, that she has her doctor to guide her, to take her hand every step of the way till she conceives. So all in all, PCOD is a very important syndrome, especially when they have infertility, and the correct treatment helps them achieve their target of being pregnant. Thanks for watching this video.